Hello, podcast listeners. You are now listening to the Coffee, Health, and Science Podcast. I'm your host, Jordan River, and I want to thank you for tuning in today. Before we get started, please share the show. Tell someone about the Coffee, Health, and Science Podcast. I say it every time, but I really mean it. It's how we grow, and it's how you could help us out so much. So I appreciate you. Hit the subscription button, the subscribe button, so you catch every episode. Today, we have Dr. Coffee back on the line. What's up, Dr. Coffee?
Hey, it's another day above ground living the dream, my friend.
That's right. That's right, it is. We are taking a new approach to some of the recent episodes here. Really quite a fan of this format. Taking a look at conditions themselves, diseases themselves, diving into them, understanding how coffee plays into the disease a lot of the time. But this is just a really, really fun and effective way to delve into health science, is it not, Dr. Coffee?
I'm enjoying it, I've written on a lot of this stuff, so it's nice to share it.
Right.
I like the fact that we are looking at things that are really important and may play a role with coffee. I think last time we did diabetes, and that was eye-awakening for a lot of people. I got a fair amount of emails from people saying that they learned a lot. And I think today we're going to talk about the nervous system, so I'm very excited about that.
Yes, the nervous system. It's actually pretty prevalent in the news right now, but you see it a lot. You know, people talking about things like neuropathy. That is really what we're focusing in on today. Peripheral neuropathy is what Dr. Coffee said we were going to focus on. So I'm really excited to dive into this topic.
Yeah, me too. I think neuropathy comes in many different names. Your people may hear about peripheral neuropathy. They may hear small fiber neuropathy. They may hear diabetic neuropathy. And there are other terms, or plain neuropathy in general. There are other terms that go on with neuropathy, but they're really all the same kind of bailiwick.
Mm.
For everybody to understand what I'm talking about, let's have a little review of the nervous system of the body.
Please.
So you have the brain and the spinal cord. They're the central nervous system. So the brain and spinal cord. And I want everybody, all of your listeners, to think of your phone lines.
Mm-hmm.
So outside of where I live in Silver Spring, Maryland, Verizon has a big building. And from that building goes a cable that heads all the way up to my small town of Columbia, Maryland.
Mm-hmm.
So the building for Verizon is the central nervous system.
Okay.
And it's the brain. And then the cable that comes up to Columbia, Maryland, that's the spinal cord. And then it splits in half, and half of it goes to the west side of Columbia, and the other half goes to the east side of Columbia. And then it branches out and gets smaller and smaller little cables until it winds up in my house. And then I'm able to talk to you on my Fios landline.
On your Bell South
Exactly.
landline?
Exactly. That's how the nervous system works. So you have the brain, the spinal cord, and then it branches out, and you've got it leaving the spinal cord at the neck, and it goes down into your arms, and then it branches out into each finger, and then it branches out to many small nerve fibers into the fingers. And it's all that branching out that we call the peripheral nervous system.
I see. So I'd imagine that if a system is going to break down, when you talk about the periphery, that's probably where a lot of the problems start when you have nerve problems.
Well, hopefully. I mean, I hate when people have brain and spinal cord problems because that's a big deal.
Right.
We're using our hands and we're using our feet all the time. And there's a relationship between the body's ability to rejuvenate that area with oxygen and blood and for the nervous system to work right. So I want you to picture that there's an environment that almost like a fish tank with a fish in it. And the fish is living in that environment, and it's got to have all the healthy things. It's got to have the right temperature of water, the right pH of water. It's got to have enough food, enough oxygen in the water. And that's the same thing that the nerves have to have in our periphery. So going down into the fingers, if you suffer from neuropathy because of diabetes or because of smoking too much, then the area at the tips of the fingers are going to be one of the first places to go because you have poor blood supply down into that area, so the nerves become damaged easy. It's all a system that works together. We are a closed system. And when you introduce something to one thing in the system to screw it up, everything else goes to hell in a handbasket along with it.
Starts to break down. Okay. And therefore you have the neuropathy, the pathology of the nervous system.
Yeah. So now I'll ask my question.
Oh, please.
What organ of the body is not controlled by the central nervous system? That's the brain and the spinal cord.
Is this a trick question and it's every organ? That would probably be my first guess. And I guess the skin would be my second guess? Or the heart? I don't know. There's 3 guesses. Yeah. I got you with a tripler.
Well, you should have stuck with your first one. It's amazing when I say to a patient, what organ of the body is not controlled by your nervous system, and they start listing out, oh, my liver, and that's controlled by the beer I drink. And, the nervous system controls everything in the body. It controls everything in the body 24 hours a day. And we have to have a working nervous system. When it starts to go haywire in the extremities outside of the brain and spinal cord system, then we call it peripheral neuropathy.
Right.
Or small fiber neuropathy or diabetic neuropathy or neuropathy in general.
The only reason I guessed that it was a trick question is because you always give trick questions. I guess I was thinking nervous system consciously controlling organs, but yeah, you're right. Now that I think about it, it controls everything. That makes sense.
Sure. So the signaling in neuropathy gets interrupted in 3 different ways. You either have a loss of the signals that are normally sent. That would be like having a wire broken. So if the cable to my house from Verizon, the one from the street to my house, was broken, I wouldn't get the normal signal for my phone.
Right.
And then the second one is that it could be inappropriate signal. And that's why I had said to you before, let's use my other landline because I have some static on the line. And so that's the inappropriate signal. Or the third is where the message gets distorted, almost like you're watching your TV and you get a fuzzy picture or a wavy picture.
Mm-hmm.
So those 3 things are the types of nerve signaling in neuropathy that can get disrupted.
So one is basically loss of power or action. The inappropriate signal, is that like, something happening that is unintended, but something still happening is what you're saying, right?
Yeah. So in the body, a common thing would be like if you have a neuroma, a area of callus on the nerve. And if you have that neuroma, it can rub and cause some static in the system. So you can feel some electrical shocks in a toe or something when you walk. And that would be an irritation to the nervous system rather than a broken nerve, a broken wire. Whereas if you're, God forbid, diving and you sever a spinal cord, then you wind up paralyzed because there's a broken nerve that's not able to tell the muscles what it needs to do.
Sure. Okay. I think I got it.
Okay. I don't care if you got it. I hope your listeners got it.
Oh my God, Dr. Coffey, you're hilarious. You're right. That's all that matters here. You paying attention, listeners? You get that pad and paper that Dr. Coffey's always talking about.
Yeah.
Okay. So what else you got for us?
So One of the reasons you and I want to talk about this is because we did diabetes. And I've said this before, diabetes is not a disease, as people call it. It's really a syndrome. And it's a syndrome made up of a bunch of different things, like heart disease and eye disease and blood vessel disease. And it also can cause small fiber disease. So the small fiber nerves are the nerves that are affected by too much sugar in the body, and they can cause a burning sensation in the feet, especially as a person gets older and their diabetes gets worse. They'll complain about lack of strength or muscle feelings. It's all small fiber neuropathy. The biggest complaint, as I said, is that they feel a burning pain. So since diabetes is epidemic right now, we are seeing a lot more patients coming in with peripheral neuropathy. And so what I wanted to do is go through some of the earlier symptoms for neuropathy that people may feel. And if so, you should talk to your doctor because it's easier to handle it before there's permanent damage.
Oh, sure.
So a person complains of strange feeling in their feet, hands, or legs, almost like insects crawling under their skin. Or they complain of balance being difficult, or when they get dressed, they have balance problems. When they go to put on a pair of pants, they have balance problems. Or they feel heavy legs. They say, it feels like my legs are numb or they've got cement on the bottom of them. They may complain of a vibration feeling, almost like they're standing on a vibration device and they feel a vibration in their feet. Or they may complain about electric shocks, so a shooting pain in the feet. They may get muscle cramps. So a patient will come in and say, I've been having a lot of spasms in my leg lately. And so one of the things besides calcium and potassium and magnesium, one of the things we check for is blood sugar to make sure it's not an early sign of peripheral neuropathy, diabetic neuropathy. Some people complain that they see a lot of blood vessels in their feet broken, or that their skin almost has an orange discoloration and a rash. And also, they can complain that their feet feel swollen. They get up in the morning and they look at their feet, and their feet are large. Or if they push into the muscle, it stays pushed in, what they call pitting edema. So all of those things are early signs of peripheral neuropathy. And if any of your listeners are having any of them, then they should contact their doctor.
Well, some of those are pretty distinct, but a lot of those you experience like a tingling or a shooting pain. Would the neuropathy be kind of constant? This is something that wouldn't come and go, or would it?
Yeah, so in the earlier stage, it could come and go, but even the coming and going is more constant than not. If you called me up and say, "Hey, Dr. Coffey, I've had a shooting pain in my foot once," then that's not it. But if you say, it seems like 3-4 times a week I'm getting this feeling of numbness in my feet, then we'd bring you in looking for neuropathy.
You bring me in and look at my feet. I know how it works.
Yep.
So what can we do as far as, we're going to get into coffee, believe me, but what can we do as far as prevention? Do we have any? I mean, I know exercise is a big part of nervous system health, but you tell me.
So there are some supplements that we give patients to help with it. And there are also some supplements that a patient can be deficient in. And I'll talk about that in a second. You mentioned coffee, as we always like to talk about coffee, especially purity coffee. But the problem with coffee and neuropathy, if you Google it all day long, you're really not going to see anything. What you are going to see is caffeine and neuropathy.
Right.
So this is one of those cases where it's really the caffeine and not the coffee. And the jury is definitely out when it comes to this. There seems to be a sweet spot of around 2 to 3 cups per day of caffeined coffee as your sweet spot. Under that can cause more feelings of neuropathy, and over that can cause more neuropathy. So I hope I said that clearly.
Okay, so it's like a biphasic effect. Is that a correct statement?
It is. So people that take their 2 to 3 cups, the caffeine can help with their neuropathy, and certain people that take 4 or 5 cups, the caffeine can make worse their neuropathy.
Very interesting. And that's the pathology itself. I did see one thing. You're right. There's really not much. When you Google coffee and anything, you usually get a huge load of search results. There are some, pretty standard articles that I'm seeing as far as coffee and pain reduction. You know, coffee can help modulate and reduce the pain because of its adenosine receptor actions. But you're right. There's really not a lot on it. But I did see that caffeine study as well.
Right. So there's a couple of studies on caffeine but that's really not because of the coffee. And then it can also talk about reducing pain. So I know with migraine patients, there's a sweet spot for coffee of how much coffee caffeine they should have in the day to help migraine. So it's very similar in that regards between neuropathy and migraines with regard to the caffeine and coffee action. There isn't really too much on coffee alone, any of the chemicals in coffee helping or hindering neuropathy, unfortunately.
Right. You mentioned supplements, though. We got to cover that, right? What can we take?
Yeah, so first of all, let's talk about supplements that can cause it. So a vitamin B12 deficiency is known for its importance for maintaining nerve health. And so people with a B12 deficiency will have pains that resemble peripheral neuropathy. And the other one is folic acid.
Oh.
So the people who come into our office and say, you know, I've been a strict vegetarian for a long time, or else I have colitis or Crohn's disease or some kind of digestive problem, those people can have a B12 or folic acid deficiency, especially B12, which is absorbed in what's called the terminal ileum. So if you have a digestive problem like Crohn's, it's going to put you at risk for B12 deficiency. In those people, B12 shots are what really work. I know that there's some sublingual B12, but really the injectable works the best. And people who are on a strict vegan diet really need to look at whether or not they're getting enough B12, and if they're not, they should supplement it.
Oh, nice.
The other deficiencies are vitamin E. So when I was first studying medical stuff, vitamin E had just come out as being the great heart saver, and then it really wasn't, and then there was a lot of bad press. And unfortunately, vitamin E has not gotten the good rap it should get. Vitamin E is really an important vitamin. Most people don't get enough of it, and it can lead to peripheral neuropathy.
Mm-hmm.
The vitamin B has a number of Bs. So B12 is one of the Bs. Folic acid is another one of the Bs. B1, which is thiamine, is probably the most important B we give with regard to neuropathy, and we use a very special type of it. It's called benfotiamine, and that's the one that's absorbed the most. There are some really good B complexes out that work with a formulation where they're most absorbed, and if any of your listeners want to find out more information on that, they can drop me an email at doc@level1diagnostics.com, and I will be more than glad to send them information on a B complex that's highly absorbed. It has benfotiamine in it. And then finally, copper is the mineral that we need to prevent peripheral neuropathy. And so that we check with people when they come in with signs of neuropathy. And then the other sweet spot with vitamin D is B6. You can either have too little or too much of B6, and that can lead to symptoms of neuropathy.
Oh.
So you have to have a sweet spot with that one.
How do we supplement copper? And is that a deficiency that's like, I mean, I assume that we get plenty from just like drinking water, well water, or how do we supplement copper?
So we use it as a mineral supplement.
You just go and buy it.
We give it as a pill.
You just go and buy copper from the store.
Yep.
That's wild. A copper deficiency.
Yep.
If you'd like Dr. Coffey's free resource, email him at doc@level1diagnostics. That's doc@1diagnostics.com. All right, Dr. Coffey, is that all of the presentation you have for us? Do you have anything else before we wrap it up?
That is it for today, my friends.
It was awesome. It was absolutely, once again, it's just eye-opening. You think you know a little about these diseases, and then we talk to Dr. Coffey, and he takes it to a whole nother level. So thank you, man. Thank you once again.
My pleasure.
All right, everybody. Thank you for tuning in to the show. Stay tuned for more Dr. Coffey, more coffee history, and plenty more coffee health and science coming at you. See you next time, everybody. Have an extraordinary day out there. Bye-bye.